Sam Laporta of the Detroit Lions suffered a knee injury today where he was actually able to limp off of the field. However, he was eventually carted off to the locker room. Following the game, Coach Dan Campbell responded to the media and said that as of right now, the injury is not as bad as it looked. However, they're going to know more information tomorrow after further testing. It looks like currently sources are saying that Sam Laporta has actually had his MRI and he's dealing with a hyperextended knee and a bone bruise, and he's likely to miss some time, but like the coach said, it wasn't as bad as it looked. With today's video, we're going to go ahead and go over the knee hyperextension position. We'll go over what exactly a bone bruise is and what a person's timeline to their recovery looks like. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy of that injury and I'll talk about what that person should expect when they come to physical therapy. If you like this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have dealt with a knee hyperextension, go ahead and comment about your experience in the comment section. We can see here on the injury video that as Laporta is being tackled, that left knee buckles and we see it bend backwards into that hyperextension position. Here we have a model of the knee joint, and so the knee joint is formed by that femur bone, which is going to come on down and form the top portion of the knee. Then we have the tibia bone, which is going to come up and form the bottom portion of the knee. And as we go ahead and flip the model laterally here, we also have another long bone located in the lower leg, and that's known as the fibula. There are four main ligaments that contribute to overall stability of the knee, and they are the anterior cruciate ligament, also known as the ACL for short. As we flip the model medially or towards the inside, we have the medial collateral ligament, also known as the MCL for short. As we flip the model laterally or towards the outside here, we have the lateral collateral ligament, also known as the LCL for short. And finally, as we look on the back here, we have the posterior cruciate ligament, also known as the PCL for short. Two other structures are located deep within the knee joint. They are the medial and lateral meniscus. You can think of these pieces of fiber cartilage essentially as shock absorbers between the femur and the tibia bones. So let's go ahead and talk about hyperextension of the knee. Anytime we're talking about knee extension, this is going to be straightening of the knee. So essentially any motion where we're going to be kicking that leg out, that's going to put that knee in extension. Anytime we're talking about hyperextension, this is going beyond that person's normal value of extension in their knee. And you can see as I do this, this is stressing all of the ligaments that are located within the knee here. So you have the MCL, the ACL, the LCL, and the PCL all at risk for injury here. And if the forced hyperextension is great enough, you can deal with essentially a ligament rupture as well. One thing to note on this video in particular is it looks like as soon as that knee is going into hyperextension, he's also getting a lot of varus force coming from the inside going to the outside portion of the leg. And anytime you get a varus force, that is going to bias and potentially affect that LCL because that force is going from inside to out. It's going to stress that ligament greatly. As of right now, they have not reported any significant injuries to any particular ligament. They just said that he's dealing with a hyperextended knee. However, it looks like based on the video that in this hyperextension position, that LCL and maybe some other structures could be involved. But the positive news is that it doesn't look like any of those ligaments have ruptured because he's already had the MRI and we have not heard that information. Now let's talk about the second part of this injury, the bone bruise. So as a person is going through knee hyperextension, if they go through excessive hyperextension, then the tibia and the femur bones can make contact, and that's essentially going to cause this bone bruising to the affected area. Now, for the sake of this model, I've actually removed the patella, also known as the kneecap, but that's another part of the knee that can also be implicated in this bone bruising because as we're decreasing that space of the joint, we're at risk for those bones essentially hitting each other. A bone bruise is definitely less severe than something like a bone fracture, so that is the step right below that. Our bones can essentially bruise just like our skin. So anytime we get a bruise, we're damaging blood vessels and we're gonna get a lot of pain and swelling to the area. A lot of times a bone bruise is not going to show up on an x-ray because usually the x-ray is going to visualize any sort of a fracture, but this is visualized in that MRI and we know that he had that MRI. So it's a good sign that as of right now, they've essentially ruled out a fracture and they're talking more along the lines of a bone bruise. Bone bruises can usually heal on the slower side and usually take about 1 to 2 months to completely heal. And if it's more severe than that, it can take longer. However, at this point, it looks like the thing that's going to keep him out is going to be that knee hyperextension. So we need to see if they're going to release any information about whether a ligament had potentially been affected or if it's something more along the lines of like the joint capsule being damaged. So we wish Sam Laporta the best of luck moving forward. It looks like he dodged a major bullet here because as of right now, they're just saying it's a knee hyperextension along the lines with a bone bruise. But it seems like he's going to have some further testing. So if I get any results on that, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update us as well. Thank you so much for tuning into my channel today and watching my video. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the other videos that I've talked about in the past. Thank you again for tuning in, and I'll see you next time.